I didn't do it, he did.
You trached this guy with a pen?
She's pretty much shocked. Okay, vertical incision, correct. That's what we use for emergency tracheostomy. Have you seen anyone slice a neck with a pen, straw, or a bottle opener? Well, this isn't a reality show. This is tracheostomy. Wait, something is missing. Now let's react to it. Hey friends, Dr. Bob here, and today I'll be reacting to wildest cricothyroidotomies and emergency tracheostomies seen in TV shows and movies. Some are impressive, some are not. Let's get into it.
We have a situation, 58-year-old male, MBC, attacking 160, BP 80 palp, decreased bilateral and breast sounds.
What did you do?
I didn't do it, he did. G.I. Joe trached him at the field before I got there.
With a pen? You trached this guy with a pen?
Okay, as you can see, that guy is already made an opening for the airway. He used his pen and he's blowing into it, so that's directly going to the lungs. Possibly the guy would have had an accident following which there is a block from his mouth, because of which there is no airway that's going. And he has somehow introduced the pen and it's doing fine. Otherwise, he won't be able to blow. There'll be a lot of blood. Though it's unsterile, a lot of infections can be there. We can just step up the antibiotics, patient should be fine.
Field before I got there.
With a pen? You trached this guy with a pen?
So?
Move this guy inside now. Come on, let's go. Move.
Trach?
She's pretty much shocked. Yeah, I know it sounds all filmy. It is pretty difficult. It is not at all easy how it sounds like. To do a tracheostomy with a pen really is something which I can't even imagine. But yeah, end of the day, patient is safe, airway secure. So yeah, patient is gonna be fine. So what is tracheostomy? Tracheostomy is a surgical procedure by which we make an opening into the trachea, which is a cartilage, following which we make a bypass from the main obstructed airway that is there, so patient can breathe and the airway is secure. So as you know, the emergency procedure, if you cannot secure airway, is to intubate. So it's suppose it's a situation where you can't even intubate. That is where tracheostomy comes to help, and thereby securing the airway.
Your lips are swelling. Open your mouth. Did you just eat something?
Meatloaf, potatoes, coffee.
You allergic to anything?
He's talking.
Guard! Going in anaphylactic shock. Guard!
Yep, pretty much of an anaphylaxis. As you can see, the patient is stressing over it, and he really can't talk or breathe. He's choking, probably his throat is closing up, and he's having difficulty in breathing. It's all a part of the anaphylaxis, probably to what he has eaten, or it can be anything that the person is allergic to.
Damn it. I gotta make a hole so you can breathe.
Okay. So he's gonna use a pen. Okay, vertical incision, correct. That's what we use for emergency tracheostomy.
Alf, get away from him!
He's having an allergic reaction. He can't breathe.
Lie on the ground with your hands behind you.
With the pen.
Alvarez, look at what I'm doing. It's a tracheotomy. Come on, man. You know I'm a doctor.
Yep. Okay, that's perfect actually. What is shown is a vertical incision that is made. Ideally, that's what the incision that we use for an emergency tracheostomy. If it's an elective tracheostomy, what we do is a horizontal incision, like probably like 2 centimeters above this total notch that we have. If it's an emergency, we make a vertical incision, open, view the trachea, insert. So to what he's doing, it's very accurate. It's good. I don't think it is a tracheotomy. I think probably it would be cricothyroidotomy, because with those minimal instruments, I don't think you can really make an opening into a cartilage, which is pretty hard. So I would rather go with it being a cricothyroidotomy than tracheostomy. And he's saying tracheotomy. So what is tracheotomy and tracheostomy? The word otomy means making an opening or an incision, whereas tracheostomy, it means making a permanent opening or a stoma.
What's wrong with him?
I have no idea.
As filmy as it is, technically there's supposed to be more blood, and knowing the fact that you're doing it not in a hospital setup, there should be more blood and bleeding should be there, which is not seen in this. And yeah, patient is fine, airway is secure. And one more thing is that once you make an opening here with a airway opening you've made, the patient can't be gasping like that, because air is directly coming from lungs and coming out. So patient can't talk, patient can't make any sounds like gasping sounds what's made in this scene. So that's kind of missed. So if you're watching till here and learn something new, don't forget to leave a like and do subscribe.
Always do. Sir, somebody call an ambulance. Here, I got.
It's good that these people are reacting to it. Trying to
Check
help
his
the
mouth.
man.
Check his mouth. There's nothing in there. All right, so let's lay him down.
Good.
Sir, just relax. Everything will be just fine.
I like the fact that they were very much active and alert into the scene. The first person goes behind the person, starts the Heimlich maneuver. starts compression, following which it's supposed to come out. Whatever's choking should come out. And Sandra, she even tells the other person to check the oral cavity, because first thing, as you can see in the oral cavity, if anything is there that's obstructing, which can be manually pulled out or taken out, it can be done. But if it's something beyond what you cannot see, that's where this Heimlich's maneuver come into handy, and that helps to relieve whatever's choking, whatever's making the person choking. But I would suggest they could have done little more rounds of Heimlich's maneuver before putting the person on the floor. Well, yeah, it's a movie.
I need a knife and a straw, please.
A knife and a straw, please.
I need to, because I'm going to perform an emergency tracheotomy. I'm going to need a glass of vodka.
But he's still choking,
Okay, sir, what I'm going to do is I'm going to find your...
Oh, God, please don't put that in.
Stop touching me. So, the cricothyroid membrane.
I like how she's actively getting into this thing, and though she's not having much experience into it, she shouldn't go and actually cut someone's throat up, because it's highly risky. And she has some knowledge, but not very much into it. Vodka, yes, the alcohol content helps in sterilizing whichever instrument you're going to use. And hot water, no, definitely no. It can cause burns to the patient, so don't even think about that. Otherwise, she's doing something, but not adequately accurate, but something's happening.
What I'm going to do is I'm going to find your...
Oh, God, please don't put that in.
Stop touching me. So, the cricothyroid membrane. The reason I'm doing this,
Oh, God.
is because you're choking. I'm gonna cut in. Wow, okay, just a little bigger. Wow, okay,
My
insert
God,
my fingers
she's
in here, because what's happening is...
gagging
Don't
there.
put your finger in there. That feels not.
Sir, what I'm gonna do is I'm going to insert the straw in the hole.
I like the accuracy, how much bleeding it's showing. It's kind of correct, not bad. And as you can see, she's made an incision. Ideally, we make this incision 2 finger above the sternal notch, as you can see. 2 fingers above that, we make an incision. And as you can see, she's saying cricothyroid membrane. Well, this membrane is present between the thyroid and the cricoid cartilage. So this is a connecting membrane which is present. Through that, you do cricothyroidotomy, not tracheotomy. So through that membrane, emergency procedure, we make an opening and secure the airway. So that's what they're doing.
And it's gonna allow the oxygen to get to your brain. Now, if you're gonna one moment, you're gonna feel the oxygen flow into your brain. There we go.
That's not oxygen. Jesus
Oh
Christ.
my
Blood.
God! Oh my God!
Blood.
That's a lot of blood.
Jesus.
Oh my God! There's so much blood.
That guy is just watching the show.
Sorry, what are you doing?
Oh my god. Oh my god. Okay.
Oh my God!
Yeah, that is a lot of blood. Oh god. Straw, first of all, not at all a good idea, because straw can buckle up, and to insert through that narrow space, straw will definitely constrict that area through which the air is supposed to go. And you can see blood came through the passage which she made, so blood was coming out like a fountain. And if she hit an artery while making an incision, there would definitely be a fountain of blood, and the patient would be like on death on spot. So end of the day, what she did was she inserted it. The other woman just gave a blow to the chest, and whatever was choking, the person spits it out. So that's what I said. If they had done the Heimlich's maneuver a little more longer, they would have probably didn't have to required to open up his neck. Yeah, I think patient is safe, so good.
911.
We already did.
Call him again. Put him on speaker.
Okay, chest compression started.
911, what's your emergency?
It's emergency dispatcher Abby Clark, Parker Center. I'm not on site. I need to speak to Stephanie Gaskins in emergency medical dispatch.
This is EMD Gaskins.
Steph, it's Abby.
Abby?
I've got an adult male, fully obstructed air pipe.
Compressions?
Yes, but he's unconscious. I can't remove the object. Can you stop breathing?
It looks inadequate chest compressions. Like in real life person, even if you're acting in real life person, you cannot do real chest compressions because it's gonna be really painful to the patient. To the person who was acting. So in the real movie scene, they could put like a mannequin, like a chest on which the person is showing the real compressions onto the patient. So it look like it is actually happening. Because in this, it looks like there's inadequate chest compressions. So the purpose of the CPR won't be coming to its point, and also will be less effective and efficient.
2 minutes ago, another 3 minutes. He's gonna have brain damage. I need you to walk me through an emergency tracheotomy.
Okay.
Abby, have you lost your mind?
Come on. You know the paramedics are gonna be at least 7 minutes. I can't let this happen.
Good that she's continuing
I've gotta
the
do
chest
something.
compressions.
You got a knife, something
We
sharp.
shouldn't stop
You're
that,
going to
no
need
matter
something
what.
to keep the airway open, like a pen or a straw.
A knife and a pen or a straw or something.
Okay, so again,
Thanks.
Find the indentation between
Conventional
his
method
Adam's
open.
apple and the cricoid cartilage.
Yep. Okay, I think I found it.
You're going to make a horizontal incision, a half
Good.
inch wide and about half inch deep.
Oh my god.
it looks like a cake knife.
Oh God, okay.
Doesn't look sharp.
There shouldn't be a lot of blood, but try to keep
But
it from
yeah,
leaking into
whatever.
his windpipe.
Okay, I did it.
Okay, stick your finger in, open it up.
Oh god. Oh my god.
There
Okay,
has to be more bleeding
Get the
than
pin
this.
in there. quick breaths. 5 seconds. 4, 3, 2. Another quick breath.
But again, if since this was emergency procedure, it's supposed to be a vertical incision because that is more easier and accessible to get the trachea. Then they have done the horizontal incision, which is usually not recommended for emergency purposes. And yeah, seems like she's pretty much entered and got through the airway. So good job. So as you can see, emergency tracheostomy is such an intense procedure. It is definitely not a party trick or something that you can learn from movies or tutorials online. So respect the airway, respect the anatomy and the training, because behind every simple quick cut, there's a surgeon who is trained for years to make it look simple. So that's all for today, my friends. I hope you guys liked this episode of reacting to emergency tracheostomy from movie and TV shows. If you guys want part 2 of this, do let me know in the comment section down below. I'll think about making a video on that. So as always, you guys take care, stay safe. This is Dr. Bob signing out.